Hi, my name is Carol Goodyear. I'm the Program Director for Nursing Research here at St. Luke's Health System. Today, we're going to be helping you appraise a Level 3 qualitative research study using the Johns Hopkins Evidence-Based Practice Appraisal Tool, specifically the Appendix E, Section 2A. So you will need Appendix D, Appendix E, and the research publication, the experiences of family members of ventilated COVID-19 patients in the intensive care unit, a qualitative study. Again, we are using the Johns Hopkins Evidence-Based Practice tools for this appraisal. There are 5 levels. 1 through 3 are research levels of evidence that Johns Hopkins recognizes. Level 4 and 5 are non-research levels of evidence. For Appendix E, you will be using any kind of article that matches the description of a level 1, 2, or 3. So those two go together, Appendix E and any level 1, 2, or 3 research study. Okay, Appendix E covers quantitative research. It covers qualitative research as well. Qualitative specifically is a level 3. There are summaries of multiple sources of research as well. And this is where you also use Appendix E. We will do another video specifically reviewing a systematic review, which is a summary of multiple sources of quantitative research evidence. So for our study today, we will be using the qualitative study, the experiences of family members of ventilated COVID-19 patients in the intensive care unit, a qualitative study. So I open this up with steps for appraising the evidence, any kind of evidence. Number 1 is always to read the abstract. The abstract gives you most of everything you need to know to understand the research and the outcomes. And then I always go to the areas where I have questions. If I have questions about the abstract itself, I will deep dive into those specific areas of the article before I read the whole thing. You always zone in on the purpose. Again, the purpose is always that last sentence of the introduction. And in this case, it's on the first page, and which is, I'm not sure what page, 869 perhaps. Essentially, it says, we conducted a qualitative study using semi-structured individual interviews to further our understanding about the effect of visitation restrictions on families of ventilated COVID-19 ICU patients. So you now know the purpose. The interesting thing about qualitative studies is that you have to really dig down into the introduction and read through it to determine several different things. Number 1 is identifying that purpose, which we just did. Is there a research question? I think here the question's not really noted, but it's implied. And then there should always be some kind of justification for the design of this study or for the study itself. And that may come across as a theory framework, or it may not. In this case, they do go over the kind of their structure. I wouldn't call it necessarily a theory, maybe it's a framework, but they go over a structure which is around known challenges for family members in the ICU. And they back those several notations up with research studies that have been done in the past, or some other kind of review of literature or something like that. So in this case, they do have a framework. I would say that it's a little bit loose around a framework, but there's enough in there to justify the design of their study. If you look on Appendix E, specifically page 6, you're going to be using Section 2, the Qualitative Appraisal A. Is this a report of a single research study? Absolutely it is. So the things I just talked about are those first 3 questions there. Is there a purpose? Is there a question? Is there justification for design in a theory and or framework? The methods section then there's a lot to the methods section. I'll just say that. This is where you get in the nitty-gritty of really analyzing whether they had credible research here, whether they chose to look at the data in a way that really represents how their experiences really were in this situation. And it's all around the usual way of how qualitative researchers do things. So for one thing, you have to have the right participants in the right setting. In this case, they chose the family members of these ICU patients. I think it's the right participants because they want to know about their experiences, and it's definitely in that right setting. Then you kind of go through and handle this idea around credibility and rigor and confirmability around the data. And this has everything to do about what the researchers are doing. So after they interview, then what happens to that data? And they specifically point this out in the methods section on page 870 in the right-hand column. They really deep dive down into exactly what they did. As data was being collected, the researchers, CC and SS, read and reread the transcripts to get a general sense of the experience of being a family member. The researchers, both of them, individually coded the transcripts by dividing the significant text segments into meaningful units, keeping the participants' own words, and et cetera, et cetera. Again, down in data analysis, they talk about getting to data saturation. And data saturation means that you're asking questions of these family members, you're getting the answers, and you're hearing the same answers. You're hearing the same things over and over, and you're not necessarily hearing anything new after a while. That means data saturation. That should always be there in qualitative research. You should always get the data saturation. They go on and talk about how they examined the codes, what they did to identify the categories. All of that is in this data analysis piece. Then they talk about rigor, and rigor has everything to do with credibility. It's that rigor with the data. Are they keeping true to what these participants said and what their experiences were? They go on to talk about how they made decisions around themes, and validating of thinking and making decisions has everything to do with confirmability. They also talk through about their own influence on the data. Researchers can influence the data just by how they think or how they're feeling at the moment. So that's another, it's kind of a drawback to qualitative research, but it's also a part of qualitative research. So not necessarily a problem. All these things are that I just talked about are really what's in this appraisal piece in A is they talk about verification processes, significant documentation of their thinking, accurate and rich descriptions of the findings. And we haven't talked about findings yet, but that's another key piece. All of those questions in there on your Appendix E, we just talked about. And you can find really, really very well done on page 870, all the things that they went through. On page 871, then they go into the results. And some of the results speak back to the trustworthiness or the fit of the data and into their themes. So it's always important in qualitative research to look at descriptives. So they will present a theme, and then generally they will present data, very specific words that came out of participants' mouths to back up what their theme is all about. So it is supporting the fit of the data into the themes, essentially is what they're doing here. And that's a congruency. And I will tell you, the results section, it usually is always pretty long. to read, and you can appreciate, having so many themes and then really talking about each theme and how it plays out in the data that they did find. Part of the overall assessment of when you get done reading it is around going back to their original question or their purpose, and then the methods they use, and do they all match up? Do the question or purpose, methods, and interpretation, did they seem congruent with each other? And this should also come out in the discussion, and their conclusions should be based on their data. And again, they should have limitations and other things to talk about in their discussion as well. And it's a truly really good research article is having this really good discussion around the data that they did find and relating it back to the purpose of their whole study, noting whatever limitations that they did have in that study. Well, I hope this helped you. Please let me know if it didn't. I'd be happy to help you. Thank you.